Hello, so today we would be talking about how much calcium a pregnant patient needs to take, because I often hear from patients that we are having so much milk, or husbands will complain she's not having milk. So there is a lot of confusion about why are we obsessing so much about milk. So essentially I want to start with calcium intake. See, a pregnant patient requires approximately 1300 milligram of calcium every day, and that too mostly in the last 3 months, because the baby on an average needs around 30 milligrams for its bones per day, right? So if your diet is good, you don't really need too much supplementation or too much milk, because for example, a cup of milk has around 475, closer to 500 milligrams of calcium. So if already one cup is giving you 500 and you need 1300, so clearly if you kind of take 2 cups of milk and don't take anything else at all, still your calcium would be nearing completion. Too much of extra of any supplementation is not good. I keep repeating in my videos that do not over supplement yourself for anything. We don't yet know the side effects of everything that we are ingesting or prescribing. So, for example, like I was telling you about a cup of milk, which has around 475, 1 cup atta, which will give you 2 to 3 chapatis, average size, would also have 400 grams of milligrams of calcium. And calcium is not only present in milk, it is also present in everything else, like green leafy vegetables, palak, and your methi, very, very good sources, bathua, saag, very good sources of calcium. You have your oranges, you have your cheese, you have your nuts, especially sesame seeds are very, very good sources of calcium. So I would want to underline that if you are having a wholesome diet, you don't have to go crazy about one particular meal. Why I talk about milk per se is because a lot of patients that I am seeing would complain of little indigestion or bloating after having milk. The reason is 1 in 3 Indians is actually lactose intolerant, and we don't even know. So if you feel that milk is creating problems, then you could also switch to soya milk or almond milk, or don't have to only rely on dairy. But if you like to have dairy, it's fine, there is no problem, but don't overdo anything and don't get obsessed with a particular type of food, is what I would want to say. Well, that's all for today. We would be coming up with more videos soon. Take care. Bye bye.